Ladies and gentlemen, welcome to It's Rainmaking Time. This is Kim Greenhouse. We have all had our attention being pulled into the healthcare debates, into Congress, into what's happening regarding healthcare. We've been viscerally dragged in and out of the situation and very upset about what's going on both sides. But nobody in Congress has talked about health freedom. Health freedom has been totally missing from health care. And the fact that it's missing called me to invite some of the world's leaders and advocates of health freedom in the entire world. Ladies and gentlemen, I have invited the Natural Solutions Foundation's trustees, General Stubblebine, Dr. Rima Laibow, Ralph Fucetola, to It's Rainmaking Time. Ralph Fucetola has been known as the vitamin lawyer, the advisor to countless natural companies, vitamin companies, medical practitioners who had breakthrough solutions to help bring them to the world and advise them properly about their rights and how they need to navigate treacherous waters, if you will. General Stubblebine has had a long-lasting work in the Army and has joined the health freedom movement, if you will. Rima Laibow has been world-renowned to help bring us the translation and understanding of how critical our freedoms are, what it means, what is on the books internationally and legally, something called codex alimentarius, and the fact that we have to be on our toes and paying attention if we ever want to have a say about what we eat, if we ever want to have a say about the nutrients that go in our body. And all of them have joined to make sure that you're clear what's on the table in terms of your health freedom and your ability to select what foods you eat. Ladies and gentlemen, welcome everybody from the Natural Solutions Foundation to It's Rainmaking Time. Welcome everybody.
Thank you.
Thank you. Glad to be here.
Thank you so much. I want to say, before Ralph begins with a very important piece of information and analysis, that we are the trustees of the Natural Solutions Foundation, and that our websites, our principal websites, are www.healthfreedomusa.org and www.globalhealthfreedom.org. And I want to take just 1 second to point out, health freedom means that you own your body. You make the decisions about what happens to it, what food you put into it, the condition and nature of that food, whether you are vaccinated, whether you use natural health techniques and have access to them or not. And the word for people who do not have those freedoms is slave. Ralph?
Exactly. And I thought we would begin with a comment directed toward what Kim had started off by saying, and that is, do the people in Washington, do they really have any idea about health freedom? And the answer is, oh yes, they know, and they're taking steps to restrict it. Good example. Congressman Ron Paul, Dr. Ron Paul, introduced an amendment to the Obamacare bill in the House of Representatives before it was passed. And all that amendment said was very simple. It said no person can be denied health care that's federally funded because they refuse to receive a mandatory vaccine or treatment. And the House of Representatives refused to protect our right to choice and our right not to be forced to be drugged. They would not put that clause in that law. And so we've set up what we call an action item, because we've learned that pushback works and that Washington responds to the citizens when we are loud enough and many enough. And so what we do on healthfreedomusa.org is we set up action items through our Health Freedom Action e-alert. You've got to go to the website and join the e-alert. It's critical. You'll receive emails that will have in them action items. You press your mouse, become a mouse warrior, press your mouse, send a message to your members of Congress, to your members of the state legislature. We had 2.8 million messages sent to federal and state legislators demanding that we not be forced to be vaccinated during the fake flu pandemic. And, of course, the government's plans to force all of us to be vaccinated evaporated. Same thing with the Obamacare law. We have an action item on our website specifically about that issue and telling the members of the Senate that if they're going to adopt a national health care law, that it has to include language to protect not just people from forced drugging, but also to protect alternatives, complementary treatments, what we call advanced health care, which is not part of the standard practice of medicine as controlled by the insurance industry. And so we want to be very clear that while we don't support nationalization of health care, we demand that if it's being nationalized, that clear protections be written into the law for people who have the right to choose their own method of health advancement. And that's very clear. We've done the same thing in the other major issue we want to talk about today, which is the fake food safety bill.
There's plenty to cover with this.
Right.
I want to go back and be clear with all of you for audiences that there was an amendment made legally to make sure that we as citizens of the United States, if a health care bill went through, had the opportunity to select the kind of care that we want and to reject care that we weren't aligned with, and that bill was denied. Right. Is that correct?
That amendment was denied. But further, what is included in the bill, as it is now going to be decided and tweaked behind closed doors in a profoundly anti-constitutional manner, what is in that bill is, for instance, that if you do not have full vaccination records, if you haven't been vaccinated with everything that the CDC's Advisory Committee on Immunization Practices, an industry rubber stamp organization, if ever there was one, with everything that they say you should be vaccinated with, whether you're an adult or a child, then what that means is that you will be denied all health care. Now, if that isn't tyranny, if that isn't bond slavery, if that isn't the ownership of your body, I don't know what is.
It is the ownership of your body.
Correct. So you must be vaccinated in order to have health care. You must have health care or pay a serious tax, which will not be considered to be a tax. I mean, this is crazy. This is the disenfranchisement of us from our own bodies.
How is it legally being adopted and left out of the conversation? In other words, why isn't Congress going through the chills reading this? Are these leaders in Congress not reading it? Do they not understand
leaders?
It?
Or are they followers, Kim? I haven't seen any leadership coming out of Congress, except for a very few people, including Ron Paul. What I see is slavish attention to the wishes of the special interest groups, the corporations that own Congress. And it's going to get worse because of the Supreme Court's insane decision that although individuals have limits on the amount that they may contribute to campaigns for political office, corporations do not, because they have something absurdly offered to them called corporate personhood, which is a fiction that can destroy any shred left of a constitutional or republic-type government in this country. It is atrocious, beyond atrocious.
I've heard about your organization for a while, and I've heard you speak on Codex Alimentarius, which absolutely scared the heck out of me and has scared me for a long time. The thing is that when you start talking about laws and things that are brewing on the books, the average person says, what the heck can I do about it? I have nothing to do with that. The people in power are going to do what they're going to do. What do you say to that?